Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. Today's session looks at support for employee mental health. For many, the holidays, in spite of the joy they bring, also adds another layer of stress. We'll look at stress management and wellness strategies, mental health impact on productivity, and prevention of employee burnout. There's much to consider about employee mental health, so let's get started. Our panelists today are Heather Washburn, Employee Assistance Program Counselor with Life EAP at Northern Light Health. Danielle Reardon, Wellness Coordinator at Northern Light Health. Libby Arbor, Program Manager of WellStarMe with MCD Global Health. Dr. Jim Jarvis, Senior Physician Executive at Northern Light Health and Director of Clinical Education at Northern Light Eastern Maine Medical Center. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Health. I'll be your moderator for the next hour. Before we get started, I will read our legal disclosure. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Our first speaker is Heather Washburn, who will speak about employee assistance. Heather?
Thank you, Dr. Gilkey, for having me today. Welcome, everyone. So let's talk about what do we mean when we say mental health? You can see that there are two different definitions here, one from the CDC and one from the World Health Organization. Both of them encompass what we're talking about when we talk about mental health. The fact that it is not just the way we think, but it's also the way we feel and the way we act. And it really includes our emotional responses, our psychological and social well-being responses to how we handle stress. It also is how we cope with stress when it comes along. Like Dr. Gilkey said, the holidays are around the corner and that stress is going to start to build up. And sometimes it affects our mental health. So these definitions tell us a little bit about the fact that mental health is a bigger picture than just the way you think. We want to think about it more holistically, with it being one portion of our well-being, alongside, of course, our physical health, our emotional health, and our spiritual health as well. You know, many people think that when you have a cold, you have a stomach ache, you have some other sort of physical ailment, that they need to go to the doctor. They're going to prioritize their mental health. They're going to make sure that they address it through medications, through herbs, all kinds of alternative methods. They're going to leave work and they're going to head right to the doctor and do whatever is needed. Now, when our physical health is poor, we do everything we can to make it better. So, how come when our minds are sick, we don't do anything? When we're depressed, we have a tendency to kind of just shove it under the rug. When our anxiety is way up here, we pretend that it's not there. We're just going to pretend it doesn't exist. How come we don't go see a doctor? What's holding us back from prioritizing our mental health? I saw somebody in the chat put stigma. You're absolutely right. That sometimes holds us back from getting the help we need. Why do we gaslight ourselves into thinking that the things in our mind don't count or somebody else has it worse? When our mind isn't healthy, it affects our physical health. We can mask it and cover it up all we want, but our physical and mental health are interconnected. And we know if one isn't doing well, then the other one suffers. I don't know about you, but when I'm particularly not at my mental best, that's when I get a cold. That's when I get the flu. That's when I start getting run down. We really want to prevent that. And one of the ways, as somebody said in the chat, to start doing that is to destigmatize how we treat our mental health. Let's take a look at some of these statistics. That's why we're talking about this today. It helps us to understand why mental health is becoming a really big part of consideration in the workplace. 62% of work days can be attributed to mental health conditions. So people are calling out sick because they're not their best. And 59% of employees report they've experienced some sort of negative impact from work-related stress in the last month. It's hard work that we do, and there's going to be stress that comes along with that. Notice that 87% of employees think that actions from their employer could help their mental health. So employees have already figured it out. We need some help. We want your support. Mental illness is the single greatest cause of worker disability in the world. And it has actually globally cost us $12 billion in working days due to us not caring for our mental health as well as we should be. We also know that when people do go to work, that productive work can help their mental health. It can help them to overcome and in recovery from their mental illness. It makes them feel included, and that's good for our mental health. And it also helps our social functioning so that we feel connected with other people. A mentally healthy workplace is clearly good for business. Decent work supports good mental health. It provides us a livelihood, a sense of confidence, of purpose, achievement, and it's an opportunity for us to have positive working relationships. Again, feeling that inclusion, feeling like you matter and what you're doing every day is good for your mental health. Now, let's take a look at fluctuations in mental health. It's not either or. We're always kind of on a continuum. Mental health means our ability to cope with adversity, adapt to adversity. And we all know that we have inability at times in the workplace to adapt to changes, to cope with the challenges that we experience. Now, though mental health distress can become mental illness, it's also possible for mental illness to develop on its own. So you'll see here, there are two different things we're talking about, and it really is a fluctuation. It's not dependent on the presence of mental distress or mental illness. There could be other components that impact our mental health, those systemic things. You might be asking, how come some people experience higher levels of mental health distress or mental illness than others? And again, the reason is that there are issues that could be present in the overall system. Think about economic vulnerabilities, disparities that can really play a cause in mental distress. Now, mental health and mental illness are also shaped to a really great extent by the social, economical, and physical environments in which people live. So, for example, I'm sure many of us here today can identify how a bad job impacted our mental health, or a bad relationship, or difficulty coping when we've had a loss in our life. Changes in our situation can cause us to have some mental distress, and over time can lead to a diagnosable disorder. Now, if we ignore the mental health and life satisfaction issues long enough in our life, though, we can develop a mental illness. So, to be at our highest functioning, it's important that we address our mental health and that of our employees continuously. Now, let's take a look continuing with this mental health continuum. We really want to understand what mental health is and how it impacts us. And the first way for us to do that is to support mental health in the workplace. Here are some signs that we might see from our employees. These signs and symptoms of distress can help us to respond in a supportive way rather than in a punitive way. As I said before, our bodies and minds are interconnected, and when one suffers, so does the other. It's also important to recognize then that when somebody is on this continuum of mental health, it's equally important to be considerate of how you respond based on that. And so, as you can see here, it's essential we focus on what we need to survive first. And then we emerge once we're more stable and moving towards that support for thriving. I think if, like a broken bone, we might need immediate help, right? We're in crisis. And then it really hurts. We go to the emergency room and then we get a cast and we're starting to survive, right? We go to some physical therapy, we start using it again. And then before we know it, we're back to thriving and excelling. The same is true of our mental health. Somebody had mentioned earlier stigma. This is how we start to take care of our mental health. Stigma stops people from accessing what they need, the help that could be helpful. You may have heard opinions like, mental health is just a reason to get out of work, or everyone has issues. Why don't you just get over it? Those kind of comments are really dismissive and they can be really damaging. They can leave people feeling ashamed and embarrassed and guilty, and then they're hesitant to reach out for help. Comments like, oh, they're just crazy or they're bipolar, that really can contribute to a culture where people don't feel cared for, and then they're going to fail to reach out for support. When we stereotype and exclude and label others, it's really the opposite of what's needed for us to heal and be our best at work. So, after all, going to a therapist or a psychiatrist or any other mental health professional like an EAP counselor is really no different than visiting your doctor or specialist to improve your health. Here are some things that we can do to overcome the stigma in the workplace. First of all, you're all doing it right here, right now, and that is attending trainings like this. Educate yourself and others about mental health. Share those real life examples of your mental health challenges. Let's destigmatize it and start talking about it. We can also help people to understand that it's a continuum, that there's a range of symptoms and they don't last forever. We can also listen to others about their mental health concerns. Truly listen. That's such a gift. We can also boost our coworkers' low self-esteems, make them feel better for themselves, about themselves, allow them opportunities to really shine. We can also offer support when we do see a mental health concern arise. We can share our own stories about overcoming a mental health challenge. And we can also build an inclusive culture where everyone is included and valued. And then, of course, encourage people to get the support they need.
Well, thanks so much, Heather. Lots of useful information there. Next up is Danny Reardon, who will speak about wellness programs. Danny?
Thank you. I am happy to be here today to touch on a few of the key benefits of having a wellness program within your company. And to piggyback a little bit off what Heather had already mentioned, the mind-body connection, it is interconnected, it's powerful. Feeling ill physically often leads to not feeling so great mentally. And then also, if you're feeling down, depressed, anxious, sometimes we see those physical symptoms increase or appear. So looking at just the mental fatigue side of things is what I'm going to hit on. Some signs of mental fatigue: irritability, frustration, anxiety, depression, general mood changes, changes in your eating habits, whether it be under eating, overeating, not getting all the nutrients and hydration that your body really needs to function and feel well. Canceling of commitments. This can be canceling appointments, canceling social engagements, calling out of work. There are some ways to reduce mental fatigue, and these are pieces as a wellness coach that I often work on with employees. Movement, any kind of movement. It doesn't have to be a structured fitness routine. You don't need to be going to the gym 7 days a week. It could be a 2-minute walk break during your workday, a stretch break, walking your dogs, playing with your kids, just moving more. Breathing techniques, yoga, meditation are a couple of avenues you can go that are more structured, but a simple 1-minute breathing break throughout your day can be beneficial. Eating balanced diet and hydration just offsets the under eating, overeating, getting what your body needs to feel well. And then a big one I see a lot is if you were to reduce your screen time, and more specifically, honestly, tends to be social media. There is a lot out there that we can absorb and digest, and oftentimes it has a negative effect. Trends within wellness. So these trends that I'm going to talk to you about today are what I see specifically as a wellness coach. I've worked in the field for about 10 years, and I actually worked in the mental health field off in various capacities for about 20 years. So these trends tend to be the same, however, they vary as to how they look. Starting with understanding, often people come in and they have a very specific goal. I want to lose weight. And we start with that, losing weight. What would that look like for you? What would be different for you if you lose weight? That's a big question. And it leads us to digging into other underlying barriers, concerns, questions that might be prohibiting them from actually diving into weight loss. So essentially, we need to build a foundation often and see, is there something there that needs to be worked on or we need to overcome before we can really start looking at how many servings of vegetables we get a day. Moving from that is the feeling of being valued. I hear time and time again from employees whom I coach that they appreciate their employer offering wellness services to them. They feel as though they really care about their overall well-being. So not just offering insurance and getting to their doctors, but they're throwing in the wellness component, and they feel like it's a strong, valued benefit for them. Trust and education, I kind of clump together. I feel like they go together because honestly, sometimes people just don't have that support in their life. They don't have somebody they can trust. They maybe feel vulnerable talking about their wellness goals or wellness needs. So working with a trusted health professional often helps them feel a little bit more comfortable and confident, which leads us to education. So again, as a wellness professional, I have real life experience, I have education, and I can really help people sort through the overwhelming amounts of wellness information that's out there. And then the other piece is accountability. Many people come in, they have all the resources, they have a dietitian, they have a therapist, they have meal plans, they have a gym. They just need somebody to be in their corner, help them point out the strengths, help them shine a light on their positives, and really just be there to cheer them along. And then the benefits of a wellness program for mental well-being. We touched a little bit on that in the previous slide. A big one, though, around your agency or business is enhanced culture. So creating that environment within your workplace and promoting improved well-being in their personal life too. So it's not just the culture of the agency, but you really want your employees to be well in all aspects of their life. One area will trickle down into the other, making healthy choices, easy choices, and routine and accessible. I've seen pieces come out of an enhanced culture at work, such as employees starting their own walking groups. I've seen accountability groups through, setting up Facebook groups or interagency emails. So it really can snowball down into places you never thought it would even go. Connection. So connection with a health coach does allow for employees to just, again, have that professional, what I do is I really help them shine that light on their strengths, look at their big wins. Oftentimes people come in just feeling defeated. They're not making progress. Things aren't going well. And it's not just with their wellness goals. It can go hand in hand with work. Work is really stressful and they're trying to, we'll go back to getting their 3 to 5 servings of vegetables a day, but they're so stressed at work and those candy bowls are everywhere. So they're probably choosing the candy, right? It's right there and accessible. So I work with them and just build a real strong bond and a good rapport with them. And through working with wellness programs, oftentimes we see increased confidence. So building confidence is important. Self-efficacy, high self-efficacy is often related to people experiencing lower levels of anxiety, and there's a reduced risk for developing depression. Greater satisfaction. This is probably self-explanatory for you all, but feeling like you're accomplishing your goals, you feel better, you're doing better. People are noticing, hey, I noticed you're walking every day on your lunch break. You just feel satisfied. So what that does for you mentally is again boosting your confidence. You're happy. You're ready to go to work. You're ready to go out and see your friends tonight. You're not canceling. And then going back to the feeling valued and supported, just feeling that your organization really values your wellness and your overall well-being versus just that insurance or that dental benefit. We recognize that wellness benefits are extra and it's up and coming. It hasn't always been a staple, but the benefits to having some type of wellness programs for your employees are just unlimited. And moving on to just key components of a successful program. Sometimes people say, I really don't know where to start. I'm not sure where to go with this. Just get started. One size doesn't fit all. You got to know your employees, know your population, meeting them where they are at. We talked earlier about making the healthy choice the easy choice. A big one would be leadership supporting wellness. So when your employees feel like leadership supports you, and really not just supports you, but they're doing it too. So they're setting an example, focusing on that healthy culture that you're going to see more success with. When they feel that support, you can establish your wellness committee, and through that committee, create a plan, encouragement, rewards, and recognizing wins. So having this available for employees, oftentimes you see incentives. Maybe it's a platform you use to log wellness activities, to earn incentives. We've had an agency that actually gave Fitbits to all of their employees to really promote more movement, simple encouragement, notes by your stairwell that say, great job, keep going, noting the benefits of taking the stairs, potentially recognizing wins. You could do an entire page on your intranet with wellness or well-being related wins, and then using what you have in your community. These are just a few of the components, but the ones that we see often.
Well, Danny, thanks for all those insights into wellness. Our next speaker is Libby Arbor. She'll speak from an employer's perspective. Libby?
Thank you, Dr. Gilkey, for having me today, and good morning, everyone. The global workforce is facing unprecedented challenges that are taking a toll on mental health and well-being. Employee mental health concerns such as burnout are a real and present threat that not only affects the organization and its people, but also the larger communities to which they belong. In fact, according to a recent global study by O.C. Tanner, 79% of employees are experiencing mild, moderate, or severe burnout. So what might this look like in your organization? It's important that organizations keep an eye out for signs of employee mental health concerns, such as a lack of interest or enthusiasm. Maybe you notice an employee is moving slower than normal. Employees may show disinterest in conversation, they may seem disengaged, or they may even be exhibiting a negative attitude. You may also see an increase in tardiness or absences, a decline in productivity, or employees may suddenly be producing lower quality work. So ignored or unaddressed employee mental health concerns can have significant consequences. If you are seeing some of these signs of employee mental health concerns at your workplace, what can you do? Reach out to employees who seem like they may be struggling. So if you suspect an employee may be struggling, the first step is to request a one-on-one meeting with them. Share your concerns and ask them if they're feeling unmotivated or overwhelmed, while also encouraging them to be honest and providing that safe space for them to share their concerns. Employees being able to openly talk about common employee mental health concerns with their manager can help them self-evaluate and prevent any issues that may come up while working together to find a solution to the problem. Send an employee satisfaction survey. Regular communication is key to keeping employees both connected and engaged. Regular communication also ensures that employees feel seen, heard, and valued. Nobody knows more about what employees want better than the employees themselves. So if you don't know what they want or need, ask them. Continuously collecting feedback from employees allow you to develop and implement programs that meet their needs. The data collected from employee satisfaction and engagement surveys can help you present the need and impact of your mental health efforts to leadership. Offer leadership training. Your employees are your change makers. And by investing in the soft skills of your employees, you can help them build strong and empathetic relationships with their team members. Compassion, empathy, and active listening are all critical leadership qualities that can enhance connection and trust. Offer employees training that includes emotional intelligence skills, such as building trust, deep listening, and mindfulness. Offer training that teaches strategies for having open conversations and delivering effective feedback. Offer training that provides tools and resources to identify team priorities. And offer training that creates cohorts to problem solve and share ideas as a team. Prioritize mental health at your workplace. Establish an employee assistance program and talk about it frequently. Employee assistance programs are designed to assist employees in coping with and resolving personal issues that can impact their work performance, physical health, or mental and emotional well-being. Promote greater flexibility and autonomy. If you can, offering flexibility is one of the most impactful ways to combat employee mental health concerns or job burnout. According to a recent study by Slack, 94% of employees say that they want flexibility when they work. Flexibility allows individuals to manage their time effectively and find what works best for them, giving them a sense of control and trust. Encourage breaks throughout the workday. Blocking off our calendars for some time away can help prevent work fatigue and burnout. So encouraging employees to scheduling time in their calendars for breaks. Now, there are two types of breaks all employees should incorporate into their schedule. The first one is micro breaks, which are short breaks throughout the workday to help employees refocus and recharge. This might look like a lunch break away from their desk, a walk outside, or a mindfulness break with an activity such as meditation. The second type of break is called macro breaks, which are longer breaks after working hours, such as a vacation, when employees shut down their laptops with the intention to fully disconnect. Now, encouraging breaks may seem like a simple and small strategy, yet this strategy can have a powerful impact if practiced consistently. And practice good meeting hygiene. Are there some days when you start your workday, look at your calendar and ask yourself, how will I get in a restroom or water break? If you ask yourself these questions on a regular basis, it may be time to reevaluate your team's meeting hygiene. So next time, ask yourself these questions. Do these meetings require my attendance? Do they also require my team's attendance? Does this meeting need to be 30 minutes, or can we shorten it to 25 minutes so I can have a quick break before my next meeting? And this is a comprehensive list of some of our current and former strategies to promote employee mental health that we have implemented at MCD Global Health. Some of these strategies have worked, while some have not. And some of the challenges that we have seen at MCD Global Health regarding these strategies have been low participation and utilization rates in wellness offerings. So some of the strategies listed are no longer offered due to the low participation and utilization rates in these wellness offerings. And this may be from the lack of leadership participating in wellness initiatives. As Danny stated, one of the key steps for a successful wellness program is that leadership must be visible. Leadership must communicate their commitment to wellness routinely, make wellness part of culture, commit financial and staff resources to wellness, and participate in wellness programs while also encouraging staff to participate. People follow their leaders. You can't pour from an empty cup. Model the behavior you wish to see. Leaders of organizations can be categorized into a similar bucket as caregivers. Leaders tend to put the needs and well-being of others before themselves. But if your goal is to improve the overall health and well-being of your employees, you must practice what you preach. And by taking care of your own well-being, you set an example for your team to take time for self-care and to disconnect. You'll metaphorically fill your cup so that you can continue to pour back to others. Remember that old analogy of the oxygen mask on an airplane. You need to put it on yourself first to be helpful to those around you. Barriers in place for staff to participate in wellness offerings. So we have received feedback from MCD employees that their schedules do not allow them to participate in wellness offerings such as the virtual book club, virtual coffee chat, virtual stress management offerings, and even employee recognition events due to other work commitments at that time. These barriers are something that we are continuously looking to remove at MCD with support from the Wellness Committee, the DEI&B Committee, and the senior leadership team. And lack of funds dedicated to wellness initiatives. Organizations may not invest in employee wellness and mental health initiatives due to the cost associated with them and the impact that these wellness initiatives could have on their budget. However, it's important to note that all employee wellness and mental health initiatives do not require a large budget or even time commitment. Small moments and interactions with employees can make a big impact. This might be praise in a private or public setting to congratulate a team member on their performance, or even a check-in to see how they're doing. And additionally, I have included the 8 dimensions of wellness, also known as the wellness wheel, into this slide. Like Danny previously stated, there is no one-size-fits-all method or solution to all dimensions of well-being. And at MCD, we strive to monitor, develop, and implement innovative ways to support employees in an ever-changing world. From the employer's perspective, this can be challenging because you're engaging in a large, diverse audience, and everyone's wellness needs are different. Many people think of just diet and exercise when they hear the word wellness, when realistically, there are various dimensions of wellness, and people can shape what wellness looks like for them. If we aren't in a good place mentally, we aren't going to take care of all dimensions of our own well-being. And if there's one thing that I want you to walk away from today and take with you, it's important to keep an eye on employees and be in touch with them to understand what their needs are. You must have buy-in and support from leaders and understand how to adapt due to changes in team dynamics.
Well, thanks, Libby. We appreciate you sharing all these details at MCD Global Health. So I have a comment from one of our participants. Kathleen shares and builds on what Libby was saying. Leadership training can also keep an employee looking forward at the possibilities of career growth rather than feeling stagnant in their current role. So that certainly plays a role in their mental health, their sense of well-being. So thanks for that comment, Kathleen. Now, back by popular demand is Heather Washburn, who will share some more ideas about what can be done to support employees' mental health. Heather?
Thank you, Dr. Gilkey. It's such a privilege to be here and talk about, I'm just going to kind of build a little bit more on what Danny and Libby had talked about, is that one of the ways that we can be supportive of others is to pay attention. When we see somebody struggling, is to really look and be approachable to help them. Listen and maintain eye contact. When you do approach them, ask open-ended questions. How are you feeling? Show some concern for them. You don't have to be really overly direct or assertive to show your concerns, but it's important that you ask. You might say, you know what, I can see that this is really hard. You know, I've experienced something similar, so I can imagine how you must be feeling. At the same time, we want to avoid unsolicited advice. A listening ear can be way more powerful than the advice that we so want to give sometimes to people. We just want to reassure people that we're there to help whatever they need. People are their own narrators of their story, and they often know exactly what they need. And very often, it's just reassurance in somebody who can lend a listening ear. Again, we can ask what they need, and then offer some options. So, for example, you know, I see that you're feeling pretty stressed right now. Maybe it's a good time to take a break. How about you go take a walk? Hey, remember those breathing exercises that Danny taught us? We can also offer them to take 5. A lot of schools are implementing this right now. It's okay to take a break. We can point out rest spaces. We can offer somebody a cold glass of water. We can provide coverage for them to have an extra break, especially when they're not feeling their best. We can also be really transparent about changes. This causes some people some worry and fear. Make sure that we're setting achievable demands of our coworkers, ensuring that their skills and their abilities match what we're asking of them, and then notifying people immediately about unplanned deadlines or exceptional needs is really helpful when we're trying to impact somebody's mental health. We can also create what I have on the slide, a work buddy system. Some companies are getting really intentional about this. This is where we pair employees, or we put people in small groups where they can sync up during their workday for a weekly conversation about work-related stress and other mental health topics. A wellness workshop where everyone is engaged and it's specific to what they're dealing with. We can also take a break with a coworker to talk through their problems rather than just sending them all by themselves. When we do that, when we get together like that, it helps us to connect. We get to share our experiences, we learn from one another, and we really gain that emotional support that is so helpful. When we connect with each other, we know that our brains send out a rush of happy hormones, and this causes us to feel way more relaxed and joyful. And then once we have those reduced stress levels, we can go back to work and be productive and be satisfied with the work that we're doing. That in turn retains our employees. So it's important that we take care of them so they're doing their best work. And then, of course, we also need to take care of ourselves so that, as Libby and Danny said, we can take care of other people. Make sure you're putting on that oxygen mask first. It's really important to note that we don't want to ever diagnose or ask about a coworker's mental health without their permission. But by understanding more about these mental health conditions and resources that are available, we can help them. We can also encourage them to call their employee assistance program as a resource, and we're going to dive a little bit deeper into that. So going along with offering our support is learning what's helpful to say and what's not helpful to say. You can see on this slide that it really matters how we go about asking people, is something bothering you? Have you spoken to anyone? I noticed you haven't been joining us for lunch lately. Are you doing okay? We can also acknowledge that maybe we don't understand exactly what they're going through, but we can see that it's distressing. And we can also ask, do you want to talk about it? And be that listening ear. Sometimes just a few minutes of taking time to listen to other people can be so meaningful and so helpful. Here are some things we don't want to say. Pull yourself together, or, oh, you'll get over it. Just get on with life. Or, I know exactly what you're going through. This happened to me. Then we tend to go into our own story. And that's not always really helpful. We can also say things like, what could I do? Is there anything I can do? How could I help you? Rather than just saying, is there anything I can do? And then, of course, like Libby talked about, it is really important that it starts with leaders. Change has to start from the top. And unless you're leading by example, it's unlikely that your employees are going to engage. They really are watching you. It's true that when it comes to helping your employees manage their stress, that it starts with you. You have to be empathetic towards others, and that goes a long way towards opening that dialogue that's so needed in the workplace. Make sure that people feel heard and cared for, respected and trusted. So first, lead by example. Model those behaviors for your team. For example, if you're having a very busy day, leaders who take breaks show employees that it's not only okay to take a break, but it's encouraged to prioritize their well-being. Leaders can also set boundaries regarding working over hours, working after hours, working on the weekends. They can also share their own personal stories about self-care. I'm clocking out at 6 o'clock tonight, and I'm not going to be available until Monday. When we say things like that, we're telling our employees it's okay to have a healthy work-life rhythm. When leaders openly talk about how they care for their mental health, they really inspire other people to do the same. And then, of course, like Libby and Danny said, we can implement policies that promote employee well-being, raise awareness of mental health in the workplace. We can allow time so that people can participate in those things. Policies implemented highlight the importance of mental health awareness and making sure those benefits cover EAP sessions, therapy sessions, paid time off, and recognition all go a long way in allowing people to take care of themselves. We can also, of course, offer flexible work hours, allow people to take that day if they need to, and also, of course, compress their work weeks if they need to take care of their mental health. We can also make sure that as leaders, we show commitment to the culture of health including mental health, and that we value our employees' mental health. Encourage staff to care for one another. Make it that it's just normal. It's how we do things around here. It's our culture. Be sure to provide adequate vacation time, even if you have to be forceful about it. Encourage people to take their time off. And finally, be sure to make sure every single leader in your organization understands mental distress and mental illness and what to look for. And then, of course, how do they access their EAP or other behavioral health resources available to them in their organization? So for example, with our EAP program, we do an orientation every 6 months or so where all the leaders always know us personally and know what we have to offer their employees. And then, of course, your human resource department is usually a great place to start if you're concerned about an employee's mental health or your own. And they may actually provide these exact same resources. If you don't already know, 211 is a free confidential information and referral source that connects people of all ages across Maine to all kinds of local services. It's a great place. It's like the old phone book. It is based in Maine and it's available 24 hours, 7 days a week, and you can reach it by phone, text, or email. But I do want to take a minute to just tell you a little bit about EAP. I am an EAP counselor. I think it's sometimes a secret, and we want people to know that we are real people doing real work. We're a full service EAP, and what that means is that all members who are get this service, their dependents and members of their household can access this service confidentially. So their employee does not know that they accessed it. There are no cost consultations, no cost counseling for mental health distress. They can also point you in the right direction to all kinds of resources like a psychiatrist or outpatient care. Many EAPs, including ourselves, offer on-site, virtual, and telephonic support. We do, like I said, in-person sessions as well. And of course, we do wellness workshops, trainings, critical incident support for traumatic instances, and all kinds of other wellness supports. And then, of course, please, if you are concerned about an employee who might be in crisis, you can call or text the 988 line. This service is confidential, available 24 hours, 7 days a week. And of course, in all life-threatening situations, dial 911 first. Thank you very much, Dr. Gilkey.
Yeah, thanks, Heather, for that sequel. Just as good as the original. I have a couple of comments to share from our audience. First is from Aaron, who suggests there may be a role for more assertive support. Go take a break, sort of an exclamation point there. And then Kathleen shares with us, instead of saying, how can I help? It can also be really nice to say, would it help if I did? It can be easier to say yes under those circumstances, particularly for a person who's feeling overwhelmed to come up with an idea of what the person could do to help. So thanks for those comments. And thanks again, Heather. Our next speaker is Dr. Jarvis with an update on health in the headlines. Dr. Jarvis.
Thank you, Dr. Gilkey. Next slide, please. So unfortunately, it is respiratory illness season, and I put up 2 slides here. One is just a map of the United States that tells us all respiratory illness activity, with the predominant respiratory illnesses right now being COVID-19, influenza, and RSV. You can see that Maine still remains relatively low, but there are definitely some spots around the country where activity is extremely high. And if you're going to travel or people are going to travel from those locations to Maine, you just need to be aware of that. Next to it, the map is a graph that basically, is a graph that talks about respiratory illnesses that are in emergency departments. And that top line in black is COVID, influenza, and RSV all together. And you can see that we are in an up climb, not nearly as bad as the beginning of that graphic, which shows where we were last year at this time. But you can see that across the country, we're seeing an increase. The only one that's seeing a decrease is RSV, but that's only for nationwide. Actually, here in Maine, we are seeing an increase in RSV cases. Next slide. So here we are looking at Maine, and in Maine, the first graphic there is around the outpatient visits for influenza-like illnesses. So that means any kind of respiratory illness that mimics influenza. And if you look at that red line, that's where we are today, and you can see that we are on the rise there. And if we look at New England as a whole, you can see that New England is also on the rise. Again, much less than we were last year, because that's what that dotted line shows. If we look at the graphic on the right, that's about influenza hospitalization. So this is specific for influenza, not just all respiratory viruses that act like influenza. Again, we are seeing an increase in that over the last 2 weeks. Not nearly as great as it was last year, but certainly cause for concern. Next slide. Specifically talking about COVID cases in Maine, this one is a little bit more concerning, because if we compare the right side of the graphic, which is information from today, to the left side, which was a year ago, you can see that we are getting close to exactly where we were last year as far as COVID cases in Maine. We know that this number is underreported because many people are actually testing at home and therefore not reporting those tests. So this is really just a kind of a snapshot in time, but shows us that we are back into that phase where we are increasing our cases across all aspects in Maine. Next slide, please. So what can employers do to support their staff and their patrons? First, encourage people who are not feeling well to stay home. That's probably the single best way that we can help prevent spread. Encourage testing for respiratory illnesses, especially for COVID. So if you have an employee who is not feeling well, particularly if they have upper respiratory, runny nose, cough, sneeze, kind of things like that, they should be testing for COVID, or if they have a fever. Have them stay home for a minimum of 5 days, and then wear a mask at work for the next 5 days if they actually had tested positive. That's the caveat there, is that they have to come out of that quarantine after they're feeling better. And so that's the important thing. Provide things like hand sanitizer and masks so that those people who want to use them on a regular basis have ready access to it, and that they understand that it is okay to do that. Making sure that you have adequate ventilation, particularly if your workplace has closed-in spaces where people have to be close together. Make sure that the air circulation is good, and maybe even crack a window now and again. Offer vaccines against influenza, COVID-19, and RSV. This is really important. So influenza and COVID-19 vaccines are recommended for anybody 6 months in age and older. RSV currently is only recommended for individuals who are over the age of 60, or women who are pregnant who will deliver their baby during the RSV season, meaning that they are close to delivery right now. One thing that you do want to do is check with your health insurer regarding coverage. Most health insurers have covered influenza vaccine for decades, but COVID and RSV are two things that become a new issue for us. The RSV vaccine is because it's new, and therefore you need to make sure that coverage got added to that. But COVID-19 for the last few years has been free to the American public because it's been paid for by the federal government. That changed this year, and now it is covered under commercial insurance. And so you do want to make sure that your insurer updated everything so that they cover all 3 of those vaccines. If you have questions about isolation, here's a great website on the CDC that actually step-by-step shows what you should do for isolation if you test positive for COVID-19 or if you're symptomatic. Next slide, please. So what about masking? We continue to hear about masking, and what is it that we should be doing about masking? As an employer, you should really be encouraging and supporting those who want to mask. Be proactive about this, like I said, about having masks out. There are people who need to mask for medical conditions because they are at high risk regardless of what the community spread is. Consider instituting masking if several employees have tested positive for COVID-19, or consider basing masking on the county COVID-19 hospital admission rates. Again, here's a website for the CDC that actually tracks this. And if you kind of see across most of the country, we're in the green for hospitalizations for COVID. That's wonderful news. But if you look up at Maine specifically, we do have a few counties and a few counties as well as zip codes that are showing some increase in hospitalizations from COVID-19. And in those areas, that means that the spread is probably more than the lowest level, and therefore you may want to consider that. And with that, I'll turn it back over to you, Ed.
Great. Well, thanks, Jim. All of our panelists will now join us on video for questions. And while the others are joining, Jim, I have a quick question for you. How does someone choose between the Pfizer, Moderna, and Novavax COVID-19 vaccinations?
That's an excellent question, Ed, and one that I get frequently. So first and foremost, between the Pfizer and the Moderna vaccines, those are both messenger RNA vaccines. Probably not a lot of difference between them. Some people recommend that you should just get the same series continuously. Some recommend mix and matching. I say whatever's available to you, go ahead and get it. Really, the Novavax vaccine, which is a much more traditional type vaccine, probably should only be used for people who had trouble taking one of the mRNA vaccines, the Pfizer or Moderna vaccine, or because of whatever reason that they have for not wanting to have a messenger RNA vaccine, should choose that one. And the only reason why I say that is because we don't have as much clear-cut data about the Novavax vaccine with the circulating variants that we do with the Pfizer and the Moderna, which we know right now is still offering very good protection, specifically for bad disease and hospitalizations and death for the circulating variants.
Great. Well, thanks for all that information, Jim. I'll remind our panelists that we only have a few minutes left, so keep that in mind when you're doing your answers. And I'm going to try to get in as many questions as possible. I'm going to start, Libby, with you. This first question. What are organizations doing to support remote workers? And I realize that'll be from your employer point of view.
Yes. So moving from an organization that was in person to remote has been an adjustment over the past few years since the COVID-19 pandemic. And what we have found is having more virtual events and including wellness efforts in our quarterly staff meetings, but also sending out employee engagement surveys each quarter as well to see what employees want for wellness services, and working as a wellness committee with leadership teams and the DEI and B committee to get everyone all on board for that.
Awesome. Thanks so much. You actually answered the follow-up question as well. You couldn't be more efficient. Thanks. Okay. This next question is for Danny. What would you recommend for checking in with others when they feel those questions are generic and rote and not genuine? So I'm tapping into how you were talking about education and trust. And Danny, you might be on mute.
I sure was. That's a great question. And I think with the experience I have, to kind of ask a little bit more probing questions. So instead of, hey, you doing okay? How was your weekend? What did you do this weekend? Have you been busy? And it takes a little bit of extra conversation, but sometimes that's when people will say, oh, it's been rough, versus I'm fine, and moving along with that. So you're kind of a little bit of a detective and doing more of the open-ended questions.
Mm-hmm. Okay, great. Thanks. Heather, I got two questions for you. So think about 30 seconds each. The first one is, can you elaborate on EAP? It seems like a standard recommendation with limited sessions. So some insight, the 30-second elevator speech.
Yeah, every single EAP is different, and every contract that we have with a company and organization is different. So for example, here at Northern Light, all employees are eligible for up to 8 free sessions with one of our counselors. It is based on the EAP. Some people have insurance EAPs, some people have full service EAPs. As to the next question, I did see that in the chat.
Oh,
Dr.
okay,
Gilkey.
good.
I'm just going to jump right in.
Go for it.
And that was, how do you refer and provide folks the best support who may need specialized or extended counseling needs? We are all, I'm a clinical social worker. I have to go within the ethics of my job. I absolutely do not go beyond the scope of my practice. And so that means if somebody needs trauma-focused kind of therapy, or they need substance use disorder treatment, we're not going to do that as EAP counselors. However, we have a great connection to the community and know the therapists in the community who could meet those needs. So if you are looking for those specialized kind of services outside of EAP counseling, we can help you find that based on your insurance, based on your situation, based on specifically what your need is. Just give us a call.
Excellent. Well, thanks, Heather. And it makes me sad to say we've reached the end of our scheduled time. We have included resources for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists for sharing Absolutely great information. I hope this hour will help you to successfully support your employees. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on January 18th. Our topic is navigating the challenges of pharmaceutical costs. We all know that pharmaceuticals are taking an ever larger share of healthcare dollar. Will help you to look at options to contain these costs. Our speaker lineup is terrific, and I hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. May you, your family, and friends have a joyous holiday season. See you next year.